So our abstract for ASTRO 2022, looking at patient-reported outcomes of this study, MC6075, where patients are randomized to de-escalated therapy versus standard of care, is going to be presented by Dr. Katie Van Abel. What we found is that patients receiving the DART regimen, 30 to 36 gray of radiation after surgery, had better patient-reported outcomes as compared to those patients receiving the standard of care. We know that physician-reported outcomes don't necessarily line up with the things that matter to patients, and that patient-reported outcomes are increasingly important in capturing the experience of the patient. We investigated in this randomized trial across arms a number of patient-reported outcome measures, including the ERTC Head and Neck 35, the Michigan Xerostomia Scale, as well as the FACT Head and Neck. And what we saw is that there were significant differences with improved patient-reported outcomes for those patients undergoing de-escalated therapy. There were no differences in the group at baseline, but over time, differences emerged. In multiple models and analyses, we saw that anywhere from 1 month to 24 months post-treatment, patients receiving the DART or de-escalated regimen reported improved quality of life or improved patient-reported outcomes in domains such as swallowing, social behavior and social eating, xerostomia, and sexual health. And again, many of these persisted over time. Humans are adaptable, and so some of them, of course, normalized, but we think that these differences are clinically meaningful. And to show that we think that they are clinically meaningful, we took an additional step where we correlated these patient-reported outcomes to objective measures. I think this is especially important in light of recent data that have shown no differences in certain settings for patients with bilateral versus ipsilateral neck irradiation. So here we really wanted to look at the patient's report as compared to modified barium swallow scores or studies. And what we saw is, yes, indeed, patients that are reporting changes in xerostomia have differences in the oral phase of eating. Additionally, patients that may report worse social eating or coughing or difficulty with swallowing indeed have findings on the barium swallow, for instance, of dysfunction in epiglottic movement. We think these are important because it tells a compelling story that patients that report that they have worse symptoms functionally have worse outcomes, and that this can impact their day-to-day well-being and quality of life, providing rationale for this de-escalated regimen. The question remains, and as I'll talk about in our next abstract, looking at CT-HPV DNA or TTMV, is can we most appropriately select the patients that are good candidates for this de-escalated regimen?